If you work with anyone with ulnar-sided wrist pain, you're going to want to watch this video. I'm just sharing with you my breakdown of looking at someone who's coming in, telling me a story, taking in their symptomology, and then thinking through where I want to look in terms of how to get started with my treatment process. This process is really important for people who are coming into you that don't necessarily have an acute injury, limited in range of motion. This is gonna be your person who can do just about everything, but still has this nagging type of issue. You have an opportunity to help them figure it out and fix them through therapy, right?
The therapy is find the problem, fix it. TFCC problems, classic activity analysis. Talk the shit. Barry, right? You have to think about the activity. So he's a golfer, he wants to golf. He said that he got injured playing golf, driving while, and he hit into mud, right? So if you're a golfer, your dominant hand, and I'm assuming he's right hand dominant, your dominant hand's at the bottom, your non-dominant hand is at the top, right? You have to bend your elbow, you have to bring your right hand over your shoulder, rotate, and then you have to swing, right? So when you swing, right? When you swing, you're supposed to follow through. You're supposed to keep it straight, right? But if he hits into something, if he hits into the ground, what do you think happens to his wrist? Right? Boom, jarring, like that. And he pulls through anyway, right? So he hits, pulls through, boom. Now you have a potential injury here. The reason why you can't just focus in the wrist, even, I don't care what the MRI says, obviously there's a sprain and strain, there's some partial tears. He's also older. Age is against you to a certain extent because you already have a certain amount of wear and tear. The man plays rugby. I cannot imagine that there isn't some form or fashion of wear and tear on his body, you know? So you're thinking through all of those things, and then you have to think about how the wrist is connected to the rest of the arm. So you can't just think wrist, boom, here. When he comes, this is it's like in baseball. You have an acceleration and then you have a deceleration, right? And then you have so like the deceleration was into mud. So how can it not come up and affect the posterior part of the shoulder? Done, period. Now, he wants you to irritate his pain, but I won't provoke and irritate someone until they sign papers and agree to be my patient. Done. I've done it before where I've done it with friends where they're like, oh, make sure, oh, let me, and then you provoke them and then you cause them pain, but they don't stay for the relief. I don't do that anymore. As therapists, you're like, oh my God, I just want to help everybody. I want to help my friends. Fuck your friends. Because if they were really your friends, they would come into your therapy. Instead of, you know, I've done it before. Been in campgrounds, throw someone on the floor, and let's take a look at your, like, but the problem is when you're only given 5 to 10 minutes, you might be able to find the problem, but no one's giving you the time to fix it. The therapy is find the problem, fix it, right? If you can only find the problem, if you don't stay to fix it, then I can't fully help you. So this guy, he's like, well, it's not hurting me that bad. No problem. You can play. You don't have to come if you don't want to. You want to play? Play. Rugby players, they'll play in pain, but one day it's going to stop you, it's going to hurt, and then it's going to be so bad that then you're going to come and it's going to take me longer, right? But here's the thing. I'm not talking to the pain. You didn't come here because of the pain, so I shouldn't talk about the pain. You came here because something is nagging your little brain that's telling you, yes, someone else is telling you, but your brain is nagging at you to say something is wrong. And I don't want to just play one-handed. I want to play two-handed, right? I can swing one-handed, but that's no fun, right? I want to be at my top form and ability. And that's requiring 2 hands. So that's what we talk about. That's what you're focused on. Otherwise, we're going like, well, it's a TFCC, and you have a high grade tear, you know, and I'm gonna ultrasound you. Like, they're gonna fuck ultrasound.
Partial tears.
It shows partial tears.
So how, you know, why isn't that like more the focus on the treatments? No, because
Why do I not focus on the partial
Yeah, you
tear?
didn't mention the tear, because I feel like if there's a tear, there's a risk of getting worse, right?
So only if he were to not treat it, only if he were to do something high impact that tore it in the first place. So part of his partial tears actually are wear and tear, right? Just because of his age and stuff like that. I don't focus on the tear because as a therapist, I can't do anything about the tear. Ligaments don't have blood supply. So if the ligament is torn, you have to sew it and use the surrounding nutrients and the scarring effect and the sutures to anchor everything down and pull it together again, right?
When is it
Best practices are when you have a big enough tear, right, to even go and do that surgery. You don't do it for a small or partial tear. You do it for a moderately big tear. And you also do it for symptom control, right? We have someone who does not have those symptoms. So why focus on the tear? I want to focus on the functionality of his arm without the pain, doing the activity that he wants to do, which is golf.
So he will be able to, let's say, strengthen his arm.
Yes,
his
with
wrist.
strengthening, you could totally eliminate the symptoms, but you can't eliminate the symptoms at the wrist level. You have to go up the arm, right? You have to find where the problem is. So there is something that's causing him that when he plays golf, so the man knows how to play, so he's not hitting into the ground. It's just that if he were to hit into the ground, it would hurt. But he played a whole thing of golf, and then he started having more symptoms, right? Stop playing golf, less symptoms. Play golf, more symptoms. So as a therapist, what I can do to make changes is find out along the chain where the problem is, strengthen, fix it. He might be missing a little bit of motion somewhere. So that's where you have to focus on technique. That's where you have to focus on the technicality of it. Where could he possibly be missing just a little bit of end range motion? His idea of having motion is not my idea of having motion. How many people have come into you and they're like, I can move my arm, and then they lack a certain amount of internal rotation, a certain amount of inferior glide of the humeral head, and because of that, all their other stuff, right, is hurting. So their idea of I have full range of motion and strength should be different from your idea of, you know, having full range of motion and strength. Does that make sense? But that's where you have to get into the technicality of it, into the nuance of all the little movements when someone is coming into at such a high level. It's not the same someone coming into low level, I can't move, my pain's a 10 out of 10. You have someone on the other end of the spectrum. I have all the motion, I have all the pain. I mean, no pain, you know, just a little bit nagging, but I know there's a problem. So now you are weeding through all the different range, all of the muscles, all of the provocative tests, you know what I mean? So that you can figure out what's wrong, and then, you know, do certain activities or positions that provoke it, so then you can find out how to fix it. So if I focus only on the tendon or the ligament of the TFCC, what can I do? Then I would be the one saying, like, his primary care, like, oh yeah, well, you can't really do anything.
So it wouldn't be like a red flag, you know, when
It's not
It's
a red
partial
flag.
tear.
It's not a red flag at all.
Partial tear in the ligaments,
Yeah.
the carpal bones is.
That's right. Partial tears totally doable. I'm not fixing the ligament. I'm just making everything else around the ligament stronger so it would support whatever is remaining. So that's why I don't focus on the ligament, because I can't sew the ligament.
Right.
And no amount of therapy is going to heal the ligament. It's just going to decrease its irritation. For rehab of the hand and protocols, you wouldn't go and do surgery. You wouldn't do, like, no, he would have been referred to a hand specialist had it been symptomology, full tear, you know what I'm saying? But he
Yes,
wasn't.
no.
Doctor was like, wear the brace, go to therapy. But nothing else was provided.
If you like this type of stuff, I have a whole program called the mentorship program, and this is exactly what we do every single month. We go and do a dedicated topic, but then we can talk about any single case that comes your way, help you to figure it out, help you to think through your cases, and we'll figure it out together. So if you want to come and join my community inside the mentorship program, then I'm going to include the link below. All right, thanks.